There's no test for men, right? So if you start a sexual relationship with a guy and he tells you he's been tested, he has not been tested for HPV and he has not been tested for herpes. So be careful. And what I tell my daughters, my patients, if you have a relationship with someone who's had, men or women, who's had 50, 100 partners, I can almost guarantee you they have genital herpes. Hi, I'm Dr. Thais Aliabadi.
And I'm Mary Alice Haney. We started the SheMD podcast to empower you with the information you need to be your own health advocate.
So today, I'll be answering all your questions on sexual health. We'll be talking about everything from STIs, HPV, herpes, and safe sex practices.
Make sure to send your questions to info@shemdpodcast.com so you can be featured on the next Dr. A episode. Thanks for tuning in to SheMD. I'm so excited about today's episode because I think that a lot of women and young girls are sometimes embarrassed to ask their doctors certain questions, even though I would never be embarrassed to ask you anything. I think there's a lot of misconception and misinformation on HPV, STD, STIs, what's the difference? And apparently you're supposed to call them STIs now, not STDs. I learned that today. We just have gotten so many questions on our social media that people want to ask you. So we're going to get real deep into these questions. But before we do that, you look exhausted. What have you been doing?
Exhausted. I've been working since yesterday morning.
What have you been doing?
Ask me what I haven't done because I've done everything else.
Have you delivered a baby?
I've delivered a baby. I've done endometriosis surgeries. I've seen tons of patients. I've rounded at the hospital. I've done a circumcision. I've dealt with other issues in my life, my children. I've done it all.
So you're tired. So your real job is getting in the way of our podcast.
This is no, this is not a job. This is relaxation.
This is fine. This is fine. Okay, we're gonna dig in. And do you find that when you have a patient that comes to your office, are they embarrassed to ask you these questions about venereal diseases or HPV? Is there a shame?
I think with my patients, it's a little different because I ask them before they get a chance to ask me. And when they're younger, they're sometimes embarrassed to ask their doctor, especially if they go to a male OBGYN. Mm-hmm. It's always intimidating. It's such a private thing. Many people don't feel comfortable talking about it. Even adults, we have women who have extramarital affairs. You know, they come in and sometimes quickly at the end, they're like, by the way, can I do an STD test? Or STI?
They throw it in right at the end.
Throw it in, right. And I just wanted to, you're right, we don't say sexually transmitted diseases anymore, even though that's how I was trained. We used to call it STDs all the time, but now we say STIs, which is a better name, sexually transmitted infections, because these are infections.
And I think that something that I think is amazing is, we've talked about this before, how you can be in a healthy, happy marriage and you can have herpes or HPV that has been in your body for a long time. But if you suddenly come home with chlamydia, he's been a bad boy.
He's been a bad boy.
So I think talk about the differences between that is going to be amazing. So let's just dig right in. Can you tell me the difference between HPV and STI?
So HPV, human papilloma virus, is a type of sexually transmitted infection. STI is sexually transmitted infection. It includes herpes, HPV, gonorrhea, chlamydia, hepatitis C, hepatitis B, syphilis, the list goes on and on. HPV is the most common STI. By age 50, 80% of women have been exposed to some form of HPV. There are 100 different strains of HPV. Of the 100, about 30 of them affect the genital area. Of the 30, 15 of them are high risk, meaning they can cause cervical cancer. Of the 15, 3 of them, numbers 16, 18, and 31, have been associated with cervical cancer, and 16 and 18 cause 70 75% of cervical cancers.
Wow, 75%.
Right. So it's very important, especially in women in their reproductive age. In addition to the pap smear, you want to make sure your doctor is also checking you for HPV. I still get patients in their 30s, they come to my office and they only have a pap smear. You have to make sure when you go for your annual exam, you ask your doctor to add in high-risk HPV. And if your high-risk HPV flags positive, one of those 15, you want to reflex it to 16, 18, and now some labs are also checking for 31.
How do you do the test for HPV?
So you can do a cervical swab or through a pap smear.
But so I'm a little confused. When you go to the doctor and you always, every year, you get a pap smear, what's the difference? They're just testing for more things that you're asking for. So they stick the thing up your vagina. They swab.
The thing is called speculum.
Yeah, they stick that speculum up your vagina. You twirl it around inside to get the tissue.
So you put the speculum in, and then you get the cervix. You have to see the cervix in order to do the pap smear. Cervix is the mouth to the uterus, right? When we do a vaginal exam with a speculum, we cannot see our uterus. We can only see the cervix inside the vagina. Then we swab the cervix with a cider brush. We go inside the cervical canal and we check the endocervical cells. And with the spatula, we check the cells on the surface of the cervix. Basically, with the pap smear alone, you're checking to see if they're atypical or precancer cells on the surface of the cervix or inside the endocervical canal. Now, pap smears are not very good tests. In order to make them better, you have to add HPV to it. HPV tests or human papilloma virus, these are viruses that sit on the cervix and they can cause precancer changes. Why is it important? If you have a negative pap smear and your high-risk HPV is positive, you need to repeat that pap smear. And if after a year your pap smear is still negative, but you're still testing positive for that HPV, you have to work that up. And that's when we do a colposcopy, where we bring the patient back and put a speculum in the vagina, put acetic acid or vinegar on the cervix, and we look with a special camera under a green light, and we take biopsies of abnormal areas on the cervix, and we send it to the lab.
How can you tell if they're abnormal?
I've done thousands and thousands of them. There's aceto-white epithelium, mosaic patterns, abnormal vascularities. There are findings that we have been trained on. Looking through the microscope, we can look at the cervix and, biopsy those suspicious areas. Usually in the hand of an experienced gynecologist, by doing a colposcopy, we're able to tell the patient whether or not they have precancer cells, and if they do, what stage it is.
And is cervical cancer always caused by HPV?
Mm-hmm.
It's always
over 99%.
Okay, 99%.
Yes.
So because kids are starting to get vaccinated for HPV, has that cervical cancer?
Absolutely.
It's gone down.
So Gardasil 9, when I started practicing, it was Gardasil 4. Now it's Gardasil 9. So there are 9 strains of HPV that patients are being vaccinated for. Between 9 and 11, girls and boys should get vaccinated as part of childhood vaccination, but we vaccinate everyone up to age 45. So if you miss that window, or if you haven't been vaccinated and you come to my office and you're 26, I'll still offer vaccination. It's a very safe vaccine. It doesn't have any side effects. When I was in residency, we were vaccinating patients. I've never, ever seen a complication with it, ever. My children are vaccinated.
So if we eradicate HPV, we will eradicate cervical cancer.
Absolutely. If everyone gets the vaccine, we can definitely.
That's great.
Yeah.
Okay. That's amazing, because there's not that many cancers where you can.
But like everything else, there's so much misinformation out there, and people are scared of the vaccine. The HPV or Gardasil vaccine is not the COVID vaccine. We have a lot of data on it. It works.
Yeah.
It significantly reduces your lifetime risk of cervical cancer.
That's amazing. Okay. So then an STI. So it's still, it's a sexually transmitted infection.
HPV is
one of the STIs.
Right.
So,
it's
and then we're talking.
most common.
Okay. And then what's the second most common?
Probably chlamydia. We see it in younger girls and boys. The problem with chlamydia is 50% of patients have no symptoms. So, it can get transferred from person to person. And when we just started, you said if your husband shows up with chlamydia, or if you get diagnosed with chlamydia and you've been in a long-term relationship with your partner, they've been cheating on you, because, especially if they've been tested in the past for it, because chlamydia, sometimes 50% of the time patients don't have symptoms of it. So if you don't have symptoms, you keep getting everybody else infected until someone becomes symptomatic, or they go and get an STI check at their physician's office, and that's how we diagnose it. It's very, very common in the younger generation, probably from 16 to 25. So anyone who comes to my office who's sexually active, 25 or under, pretty much I will force them to do an annual STI testing.
And you, like HPV, you always have it for your entire life. With chlamydia, can you get rid of it?
Yes, chlamydia, you will get rid of it. You have to make sure you diagnose it correctly. Once you treat the patient, you also want to make sure you treat their partner. And usually we bring them back a month later for test of cure, meaning we want to make sure that the antibiotic worked and the chlamydia is treated completely. With HPV, it can be dormant in your body for many, many years, or your immune system can completely suppress it. It's hard to say, because when it's suppressed or when it's gone, you just test negative. So these are patients, you can be in a relationship with your husband for 7 years, and usually stress or anything that will lower the immune system will reactivate this virus, and that's when it starts showing up again.
And then you hear of people getting throat cancer from HPV too. So is that true? Is that sometimes happening because of HPV?
So HPV, especially 16 and 18, have been associated with throat cancer. I was reading a study how gynecologists actually have a higher risk of getting throat cancer because of all the procedures we do, right? We do pap smears, we do colposcopies, we do LEEP procedures in the office, and you inhale this the HPV from the patient's cervix. And yes, it can cause throat cancer. So if you, if you've had oral sex with a partner, especially if you've been tested for HPV 16, 18, it doesn't hurt to see an ENT. I went to my ENT once and I said, look in my throat, because I've done thousands of these procedures. And he looked at it and he's like, you know what, you can come every year if you're at risk, but it's not standard of care right now. But I would still say if you've been exposed to HPV 16 and 18, it's important to definitely check for throat cancer. We also do anal paps for patients with 16, 18 HPV. Okay. The problem with HPV is that there's no test for men. So when you
didn't you tell me the only test? They'd have to stick it right up their penis.
There is an upper urethra. No one's going to do that. Yeah. So we don't really have a good test for men for HPV. The only way we know that your partner could have it is when the wife gets tested positive, and even when women get tested, we can never blame the current partner because that HPV could have been dormant for many, many years. So if you show up with herpes or HPV suddenly after being in a long-term relationship, then you don't know where you got it. You don't know where you got it. You can't really blame your partner. So when it comes to HPV, if your pap smear is negative, but your HPV 16 or 18 and now 31 is positive, then we recommend colposcopy. Colposcopy is a diagnostic test where your doctor will put a speculum in the vagina, put acetic acid on the cervix after numbing the cervix. At least I numb the cervix. And you look at the cervix with a microscope and you look for abnormal areas on the cervix and you take a biopsy. Patients with a negative pap smear and HPV 16, 18, or 31 positive do need a colposcopy.
What are the symptoms of chlamydia? If you have symptoms, what do they look like?
So it could be pelvic pain because it's a common cause of pelvic inflammatory disease. So these are young girls who sometimes end up in the emergency room. They end up in the GYN office with lower pelvic pain, and on exam they have cervical motion tenderness. They start getting abnormal discharge to a point that, they end up in an office and they get tested. It's important though for physicians to recognize that when you have a woman who comes to the office complaining of abnormal discharge or pelvic pain, you have to make sure you do an STI testing. Sometimes, for physicians, especially when you have a woman in your office who's married, you can't just assume that they won't have an STI. You can never assume. So if patients come in complaining of abnormal discharge, sometimes purulent discharge from their cervix, pelvic pain, you have to make sure you test for everything.
And what happens if you don't get it treated? Does it do anything?
Yes, it actually can cause scarring. Chronic chlamydia infection can affect your tubes. It can have blockage of your tubes. It can give you pelvic inflammatory disease. There are patients who can get tubal ovarian abscesses from it. So it's not something you don't want to treat, especially for young women who want to have children. That's why it's so important when anyone who starts a relationship, men or women, young or old, it doesn't matter. You have to make sure your partner gets tested.
Do men have any symptoms for chlamydia?
They can have discharge.
Okay.
Yeah, absolutely.
And then what about herpes?
Herpes is a tricky one. And there's a lot of misinformation. I feel like people confuse HPV and herpes. I had a physician, I think it was a primary care and ophthalmologist, not even confuse the two. I was talking about herpes and she was talking about HPV. These are completely different viruses with completely different symptoms. So human papillomavirus is the virus that can give us genital warts and cervical cancer. Herpes is a virus that can cause genital herpes, and it's the same virus that can give us cold sores.
I thought they were different viruses. The cold sore.
We have two types of herpes virus: herpes type 1 and herpes type 2. A lot of us have heard about that. Most people think oral herpes, the cold sore, is type 1, and genital herpes is type 2. False. Okay, so let's make that very clear. When it comes to oral herpes or cold sores, 90% of it is herpes type 1. 10% could be herpes type 2. When we talk about genital herpes, about 50% is type 1 and 50% is type 2. Does it make sense?
Yep.
So the reason we don't randomly do herpes blood tests when people come for STI testing is because a lot of us, including myself, will test positive for herpes type 1 because since I remember, I was 5 years old, I had cold sores.
Me too. My mom had them all the time when I was little, and I get them all the time. As an adult, I've gotten them less. When I was younger, I would get them all the time.
And if you grow up in a country like I did in Iran, where people kiss every time you see
you're just passing it on.
Just passing it on. It's very, very common. So herpes type 1, if you get tested in the blood and you have herpes type 1, that doesn't mean it's oral. It could be genital.
Okay.
That's why we don't randomly recommend blood testing for herpes. That's number one.
Okay.
Now, there are patients who come and say, you know what, I just found out I've been having a relationship with this guy for a year and I just found out he has herpes type 2. Can you test me? Yes, we can. And when we do a blood test, we can pick up whether or not, she was exposed to the herpes type 2 virus, for example, or herpes type 1. But in reality, unless you have lesions in your genital area, you don't need to basically talk about it to your future partners.
What do the lesions look like?
They're basically the first time you get a genital herpes, for anyone who's had it, it's very painful. It's ulcerated. These are patients who come in. They're very uncomfortable. As soon as they tell me, I can't sit down, it hurts down there, I know the diagnosis.
Okay.
Usually they have fever-like, flu-like symptoms. With the first episode, they have enlarged lymph nodes in their groins. And so just by listening to them, you know what the diagnosis is. So it's important when, as physicians, when we see those lesions that are active, we culture it and we send it to the lab, and we basically diagnose whether or not those lesions are herpes type 2 or herpes type 1.
And why does it matter?
Herpes type 2 tend to be more aggressive and more frequently it comes back. Herpes type 1 is a little bit less aggressive. But when it comes to genital herpes, type 1 or type 2, same thing. If you have been diagnosed with genital herpes, you have to let your partners know. The problem is, especially in cases of men, they either don't share with us or they have the virus, they shed the virus, right? But they've never noticed any lesions. So they infect every woman they sleep with without really getting blisters. For example, it's the same thing as oral herpes. You don't have to have a lesion on the labia to get someone infected. You don't have to have a lesion on the penis or the scrotum to get someone infected. A lot of times we're shedding the virus without any lesions. And so you have to be careful.
And what are the treatments?
Once you get diagnosed, the treatment for the primary genital herpes is, I usually like Valtrex, 1,000 milligrams. You have to take it twice a day for 10 days. If it's, a recurrent infection, let's say it could be, usually in the first year, especially with herpes type 2, these patients, especially if they're anxious and stressed out, they keep getting these infections. And for the recurrent episodes, we basically treat with Valtrex 500 milligram, half the dose, twice a day for 5 days. So there's also topical ointments, acyclovir ointment patients can use on the lesions if it's really, extensive and it hurts. There's a acyclovir pill. There are different medications that people can take.
And what if you don't treat it?
So if you don't treat it, it will go away eventually, but it'll be a very long and painful process, especially for the first infection. With the subsequent infections, it's not as difficult. It will go away.
It's not like untreated chlamydia.
No, not at all. It will go away. The problem with herpes is it stays with you for the rest of your life.
Thank you, sir.
Yes, and that's why you and I cannot get rid of our cold sore, right? Every time you're stressed out, every time you get sick, every time you're anxious, you might feel tingling in the corner of your lip.
And I feel feverish when I get that's when I can remember being little and getting a huge cold sore on my lip and feeling like feverish.
But most of us will have some tingling sensation, some sensitivity of the skin, and it's coming. If you know it's coming and, at least you feel like it's coming, you can even put the ointment on every 3 hours to prevent it from coming out. If the sensation, if you start getting tingling, itching, irritation, and you have been diagnosed with herpes, you can just start taking your Valtrex twice a day and prevent it. The treatment for oral herpes is different. You take 2 grams of Valtrex in the morning, and 12 hours later, you take 2 more grams of it, and hopefully it gets rid of it. I personally, for cold sores, love the acyclovir ointment.
Let's get to some of these questions. I'm worried I may have been exposed to genital herpes. If I don't have any sores, should I still get tested?
With herpes, it's tricky. Again, if that patient had has a history of cold sores and you test her, because you can't really test, there's no lesions for her to test, right? You have to do a blood test. And if you do a blood test and he tests positive for herpes type 1 or 2, how do you know where it is? You don't know if it's on her mouth, if it's in her genital area. For this patient, I would say be careful. If you think you have a high-risk partner, make sure you use condoms. If they have a history of herpes, they need to take Valtrex every single day. If your partner takes Valtrex every single day and you use condoms, you will significantly reduce the risk of transmission. If you think you've been exposed, make sure you look for lesions. Give it, up to a week, 2 weeks. See if you get lesions. If you don't get any lesions, that doesn't mean that you're not going to get it, because you can get exposed to the herpes virus, not have a blister until 2 years down the line.
So when you say look at it, take a mirror and actually like go down there and look.
You don't need, you'll know if you have genital herpes. It'll be so irritating, itchy, painful, ulcerated. Just be aware of it, that if you've been, exposed to it, that you might get it.
As a woman who has sex with women, what STI risks should I be aware of, and how can I protect myself?
All of it. All of it. All STIs that affects heterosexual women will affect homosexual women as well. So it's very important, once again, before having intercourse with anyone on this planet Earth, make sure, especially if it's a woman, make sure she's had her pap smear, make sure she's been tested for HPV, make sure she's done a full STI panel, which includes HIV, hepatitis B, hepatitis C, syphilis, gonorrhea, and chlamydia, and HPV.
What's the most dangerous STI?
Well, HIV is better now. Hepatitis C is very concerning because after getting infected with Hep C, a lot of times, about 10 years post-infection, a lot of patients are at risk of cirrhosis of the liver. Hepatitis B, it's a lifelong infection. You can transmit it to your children during childbirth if it's not tested. HPV can cause cervical cancer. So I would say just try not to get any of them.
I've heard that some STIs like chlamydia can cause infertility. As someone who wants to have kids someday, how worried should I be?
If you have had regular STI testing and your chlamydia test has been negative, you don't have to worry about it. For patients who've had chlamydia infection, especially when they find out months or years after, it's important for them to maybe consider doing a procedure called hysterosalpingogram before trying for pregnancy to make sure the tubes are open, because chronic chlamydia can affect and scar down our fallopian tubes.
So if you've had chlamydia and you're having a hard time getting pregnant, that might be something to look at. Okay, that's interesting. Are HPV infections symptomatic, and can people always tell if they have it?
So HPV, as long as it's genital warts, yes, you can see it. They look like skin tags. Sometimes people think they're skin tags, but they're actually genital warts. So it's important to go to your gynecologist or a dermatologist and show those lesions. But for the high-risk HPVs causing cervical cancers, no, unless, you do have cervical cancer and you start having abnormal bleeding, which is hopefully there's no need to get to that point.
Right.
If patients do their pap smears regularly, they get checked for HPV on a regular basis. They look for skin tags on their genital area. All of it should be prevented.
When you say skin tags, are they little or are they
tiny?
They're little.
Yeah,
okay.
Little skin tags.
So when I think of a wart, I think of a big fat wart. It's not that.
That can happen too, but that happens when you ignore it for a very long time.
But they start as these little teeny lesions.
Tiny,
okay.
Yeah. And if in doubt, remove it.
Right. That's what happens on my face. I get everything blown off. But when in doubt, it looks like skin cancer, this Irish skin. Does the HPV vaccine promote sexual promiscuity among teens and young adults?
Oh my God.
I know.
I hate this because a lot of parents tell me, well, I don't want to vaccinate my daughter because she's going to think she can go out there and have sex. That's not true. First of all, we vaccinate girls between 9 and 11. They don't even know what these vaccines are at the time. They don't even think about sex, at least majority of them. So I think it is irresponsible of parents not to vaccinate their children when we have such, such an impressive track record on HPV vaccine. So I would say no.
Okay.
Because if your daughter wants to have sex, she'll have sex whether she's vaccinated or not.
Exactly.
So why not protect her before she's sexually active?
Yeah. I had unprotected sex last night and I'm freaking out. How soon can I get tested for STIs, and should I take emergency contraception?
Well, if she's not on any birth control pills, yes. And if your partner came inside of you without a condom, absolutely, unless you want to get pregnant. Better than that is to, discuss some method of birth control with your physician so you're not in a situation where you have to take a plan B, for example. When you think you're exposed to an STI, for some infections like HPV, we can't test you within a few days. Now, if it's chlamydia, if it's herpes,
Gonorrhea.
it'll show up within the first 1 to 2 weeks. But for HPV, you need to give it at least a couple of months. So what I would recommend is within the first 2 weeks, do an STI check and then repeat it at 2 months and then repeat it at probably 6 months.
And what is gonorrhea?
Gonorrhea is another common infection affecting a lot of young teenagers, very similar to chlamydia. And it can also cause pelvic inflammatory disease. It can cause abnormal discharge, pelvic pain, and easily treatable. Again, it could be asymptomatic. So it's part of our STI testing, especially for women and men 25 and under.
And what are the symptoms? How are they different from chlamydia?
It's tricky. It's hard to tell the difference on a pelvic exam, but you can get purulent green discharge, pelvic pain, PID. So you just have to send it to the lab. Antibiotics.
Okay.
Yeah.
Right. But how come an antibiotic, it's a virus? I thought antibiotics could
Gonorrhea and chlamydia are not viruses. They're bacteria.
Okay.
That's why you give, that's why like azithromycin, ceftriaxone, doxycycline.
Thank you for clearing that up. That's great.
HPV and herpes are viruses.
And you can't do
hepatitis B, hepatitis C. Yeah, but gonorrhea and chlamydia are bacteria.
Do all HPV infections lead to cancer or serious health issues?
Not at all. So remember I said there are over 100 different strains of HPV. 30 of them affect the genital area. 15 of them are high risk. The high risk ones can cause cervical cancer. But even if you get infected with the high risk virus, that doesn't mean you're going to get cervical cancer. But it means that you have to be more careful. Make sure you do your pap smears. And if you have any abnormal pap smears and if your HPV doesn't go away after a year, you're going to need to do a colposcopy.
Can only sexually active people contract HPV, or are there other ways of transmission?
There are other ways of transmission. The most common is sexually transmitted skin to skin, but it could be from dirty towel. It could be extremely rare, but it could be from dirty equipment, medical equipment. But the most common way of transmission is skin to skin.
What about hot tubs? Can you catch an HPV?
Not inside the water, but you can get it from like sexual toys.
Okay. Is it true genital herpes is only spreadable when you have an active breakout?
False. A lot of people. So that's a very good question, right? Because when someone has blisters, they already probably know that that's herpes and they avoid sex. Right. They come up with a million reasons not to have sex with their partner, especially if they haven't shared that with their partner. Now, what they don't know is that before the blisters come out, they're shedding the virus, and that's when they're infecting everyone. And a lot of people don't even get the blisters. They just shed the virus. I exposed half of my children to the cold sore. I haven't had a cold sore in many, many, many years, but 2 of my daughters have it, which means I was shedding the virus on my lips, not knowing, and I probably kissed them.
Yeah. Is the HPV vaccine only necessary for young girls, or should boys receive it too?
Boys and girls, they get us infected. There's no HPV test for men, so they have to get vaccinated so they protect us and they protect themselves. So all boys, all girls, 9 to 11 should get vaccinated with the HPV vaccine. It's a 3-shot vaccine. The day you get it, in 2 months and 6 months, you get the booster shots. And for anyone who misses that window, they can get it up to age 45.
Okay. Can I still have sex if I have an STI?
It's best not to, right? Especially, for example, I was telling you, you can have sex, but you have to use protection. If it's chlamydia or gonorrhea, we usually want to treat your partner, treat you, do a test of cure, 2 weeks, 4 weeks down the line, make sure they're both negative, and then they can resume sexual activity without a condom. If it's HPV, then we usually recommend using a condom for 6 months to a year until the HPV is removed. 75% of women will suppress or get rid of their HPV in 1 year, and 90% will get rid of it in 2 years. So usually for patients who especially are not in a monogamous relationship or they're not in a serious relationship, I would say continue the condoms until the HPV is completely negative.
My partner and I recently became exclusive. Is it okay to stop using condoms if we've both been tested for STIs and it's negative?
So what are the 2 infections that the partner was not tested for?
HPV.
Correct.
And herpes.
Correct. Very good.
I see what I'm learning. So get tested for those.
But there's no test for men, right?
Yeah, there's no
so
test for
if
men.
you start a sexual relationship with a guy and he tells you he's been tested, he has not been tested for HPV and he has not been tested for herpes. So be careful. And what I tell my daughters, my patients, if you have a relationship with someone who's had, men or women, who's had 50, 100 partners, I can almost guarantee you they have genital herpes, right? Because 20% of the population has the genital herpes virus. So when you have so many partners, at some point you've been exposed. So be careful.
Think about it. Every time you have sex with somebody, you're having sex with every single person that they've had sex with. So
Correct.
if you've had 100, you probably had 1,000,000 sexual partners because that person has had sex with that. I've been experiencing a burning sensation when I pee and some unusual discharge. Could this be signs of an STI like chlamydia or gonorrhea, or is it most likely a yeast infection?
So first of all, yeast infections do not usually cause bladder symptoms. So if you have burning with urination and you have discharge, you have to get tested for gonorrhea and chlamydia. If you have burning with urination, you need a urine culture to make sure you don't have a bladder infection, right? Mm-hmm. Because bladder infections will give you burning with urination, pain, pelvic pain, frequency, urgency. Now, chlamydia and gonorrhea can give you bladder symptoms. They can give you the discharge. They can give you the pain. So as part of the workup, you do need to test them for gonorrhea and chlamydia. Yeast infections usually don't have bladder symptoms. Yeast infections will give you a cottage cheese discharge with a lot of itching. And usually the discharge doesn't smell.
So this isn't a STI question, but this is a question that a reader put on our social media, which I am really excited to talk about. How long should I wait to resume sexual activity after giving birth? I can just say for myself, this was something I was really concerned about because I had 2 difficult births and I had to get restitched twice. And my stitches popped and then it happened. I mean, it was just
I've ever done that, by the way.
It was awful. I mean, the first time I had sex after that, I was like, I waited a long time because I just was so traumatized by it. And then is there a rule? Do you tell your patients?
So wait, you had a tear, they repaired it, and then they had to
split again.
Ooh.
They repaired it.
Were you like
split
super
again.
active, having sex?
No. I think I was allergic to the stitches. And I don't know. It was terrible. I had my baby nurse, Nanny Connie, who we had on the show. I literally was like, spread my legs. I was like, you have to look. Something is wrong. And she looked and she's like, we're going to the doctor.
So let's talk about that. Postpartum, usually we say 4 to 6 weeks, right? Mm-hmm. For women who've had multiple vaginal births, they push a baby out and they have no tears and their uterus goes back to normal. They can start all activities at 4 weeks. Usually I say 6 weeks postpartum. And for women who have a tear, like a 1st degree, 2nd degree, 3rd, or 4th, I usually say 6 weeks because anytime you do any kind of stitching, it'll take 6 weeks for it to heal, right? So you have to wait 6 weeks. Now, if you're postpartum, especially if you're breastfeeding, the vaginal tissue is very dry. With or without a tear, it hurts when you first start having sex. So that's normal. And patients feel very dry. That's why we always recommend lubrication for patients who are uncomfortable, especially the ones who are breastfeeding. But it'll eventually go, it'll go back to normal.
I have a high-risk pregnancy. Is it safe to have sex? Should doctors have told me it's okay?
So high-risk pregnancy is a very wide spectrum, and it depends on what's causing the high-risk pregnancy. If you're diabetic, you can have sex. Mm-hmm. But if you have placenta previa and it's blocking your cervix and you're bleeding, you can have sex. Okay. So it depends on what the reason for that high-risk pregnancy is. Otherwise, if, everyone can have sex during pregnancy. You can enjoy having sex. But if your doctor tells you not to do it, when we put patients on pelvic rest, they're bleeding, their cervix is short, they have preterm contractions, for any other reasons, then, you have to listen to your doctor.
Last question. Do condoms protect you against herpes?
They do, but maybe by 30%. And the reason for that is when you use condoms, you just protect the shaft of the penis, right? Mm-hmm. You can have herpes lesions on the scrotum and on the, anywhere in the genital area. So we know that herpes gets transmitted through by skin to skin. Mm-hmm. So using condoms help, but if you or your partner are herpes positive, or one of the partners is herpes positive, besides condoms, they have to take Valtrex daily.
Okay, I have learned so much about STIs, and I wish I'd known all of this when I was 16. I think that, especially for our generation, we just didn't talk about it. We didn't even talk about having our periods. I mean, it was just, it's a very shameful thing, and it shouldn't be. If you are old enough to be having sex, then you need to understand the risks that come with it and how to take care of your body. So thank you so much for this.
Of course. Thank you.
This is a great episode, and keep sending us your questions. These are amazing. Remember, if you want to own your own health, a good place to start is by following us on social media at SheMD Podcast, and by subscribing to our show on YouTube or wherever you get your podcasts.
To learn about today's episode, visit our website, shemdpodcast.com. And don't forget to submit your questions for our next Ask Dr. A episode to info@shemdpodcast.com. We'll see you next time on SheMD.
This podcast is for educational and entertainment purposes only. It is not intended as a substitute for a physician's medical advice. You should regularly consult your medical provider in matters relating to your own health. Even though we share our honest beliefs on SheMD, some of the products and services we discuss may involve sponsorships or paid advertising.